Hi everybody, Kate here, one of our physical therapists at our East Norristown location, here to go over my best recommendations for knee swelling, and more specifically, how to use kinesio tape to address it. This can be knee swelling post-operatively, so say you just had a knee replacement or an ACL repair, or maybe something that's more chronic. You find that there's just a pocket of fluid on the inside of your knee, outside, above, over the kneecap. Any of these areas, this taping could potentially be beneficial. Like I said before, taping is one of those things, sometimes it works great, sometimes it doesn't do anything. But the purpose of the taping is essentially to facilitate what we call lymphatic drainage. It's trying to help the lymphatic system, which is a huge part of how our body sort of flushes and circulates different areas of our body out. And sometimes things just get stuck, things get clogged in different joints for a number of different reasons. And the purpose of the tape would to be trying to facilitate movement of fluid away and back into towards the heart to help it circulate through the rest of the body. So with the knee and with swelling in general, if you're trying to use this, the concept is you're really trying to sort of cross these two pieces over wherever the swelling is. So this applies to the arm, this applies to the ankle. Again, in this case, we're gonna do the knee. So say I have a lot of swelling in my knee, and say I have a lot of swelling on this is where I have a lot of my swelling, on the inside below where my kneecap and my knee is, okay? This is a common area where swelling sort of pools. So what I'm going to do is take these two pieces, start below where that fluid is, and sort of crisscross them over, okay? So the first thing that you have to do is you have to cut your kinesio tape. This is about 6 inches long, and as symmetrically as you can. Mine aren't the most symmetrical, but it doesn't matter. 1, 2, 3, 4. So usually what I'll do is cut it right down the middle here, and then I'll cut those two halves in half. So I have 4 total pieces here, okay? Always leave an inch at the end, so the kinesio tape can stick directly to the skin without any tension on it. So I'm gonna pull it right where all of those pieces are cut but stop, and I'm gonna pull this piece off, okay? And again, I'm starting below where the swelling is. So say all of my swelling is in this area, I'm gonna start below, okay? No stick when you put it down, all right? Then one by one, I'm gonna cross the area of the swelling, okay? So what I'm gonna do is put a tiny little stretch on that knee, or on the kinesio tape, okay? And then I'm gonna place it down, so then the top part of it has no stretch. That goes right down, okay? Then we're gonna do the same thing here. Little stretch. And as you can see, I'm sort of fanning this out a little bit. And this can be, you can do this more across if you have more swelling here. I could have pulled this more across if I wanted, but in this scenario, all of my swelling is sort of right in between my fingers here. So I'm really trying to keep it local to where that is. Here and here. It doesn't really matter the position of your leg, whatever's most comfortable. The purpose of these videos is to sort of teach you how to do this to yourself, okay? So as you can see, this is really covering that circle I talked about. The next piece, so this would be effective, right? So you could just start with something like this. If you find that it helps, then you could do the second layer. But if you want to just start with one, that's fine. But second layer would go sort of on the other side, all right? And I'm gonna do the same thing. I'm gonna cut it down where all those little pieces connect. Little piece at the end, no stick, down on the skin. All right, and then one at a time, I'm crossing that same area here, okay? So I'm just gonna come up and across. Little pull, no stretch at the end. Little pull, no stretch at the end, all right? Now with this, like I said earlier, this is one of those things where sometimes it works great, sometimes it does nothing. This should be a significant difference in both the swelling the pain and the mobility of the joint by the next day, okay? The results with this are pretty significant and pretty instantaneous, that being in the next 24 hours, okay? If you found that you tried this and it didn't really, you're like, I don't really know, did this work, did this not work? It probably didn't work, okay? Maybe you can trial putting it in a different area or maybe adding a little bit more tightness to the kinesio tape, but this is sort of the end result, okay? So it kind of look like a little cross pattern here. As you can see, it is covering that area of my swelling, okay? I do this a lot with knee post-op, so if any of you knee replacements out there, you guys always have so much swelling in the front of those knees. In that case, I usually start here and here, and I'll come across the whole knee, and I'll fan this out a lot wider. So a lot of variations with this. You can kind of play around with a couple of different things, but this is a great technique that I use successfully with a lot of my patients. The last thing I didn't mention, heat activated, so just kind of rub over it. All right. Stays on for 3 to 4 days. If you get any redness, itchiness, take it off. But otherwise, this is a great tool. I hope it helps. Good luck.